let's take you to the health report card of the country state-wise. Now, the health index ranking announced on Friday said among the larger states, now Kerala, Punjab along with Tamil Nadu ranked in top turns of the overall performance and became the front runners. This was the first category. Now, the health index report says Jharkhand, Jammu and Kashmir and Uttar Pradesh showed the maximum gains and improvement of health outcomes from base to reference year in indicators such as neonatal mortality, rate under 5 mortality rates, as well as full other institutional deliveries that were possible then. And people living with HIV or other anti-retroviral therapy, the Health States Progressive India, based on the composite index for the reference year 2015-2016, is what we're looking at. The states are grouped in 3 major categories. Now, they are aspirants, achievers, or the present aspirers. Now, the middle third states with an index score between 48 and 62. Now, overall, these states have made good progress and can move to the next group with sustained efforts. Those are the front runners. Now, the top 1/3 states with an index score of above 62 are, in fact, the best performing state. Now, despite the good performance, however, even though the front runners could further benefit from the improvements in certain indicators, as the highest observed index score of 76.55 is still well below 100. Now, looking at the aspirants, they are the bottom 1/3 index, which includes the state of Uttar Pradesh, has been battling severe health crisis recently as well, is below 48. These states are largely the Empowered Action Group, or the EAG states as they're called, which of course does not include Chhattisgarh state. And given the substantial scope for improvement, they require concentrated effort. And joining me on the program is Dr. M. Wali, a senior consultant in medicine at the Gangaram Hospital. Good evening, Mr. Wali. The report highlights that non-communicable diseases, or the NCDs, have emerged as the leading cause of morbidity and death for adults, contributing to nearly 55% of all diseases burden and more than 62% of deaths in the country. When compared with India's economic progress and achievements, the rates of improvement in health outcomes have remained slower than that of developing countries, which have, in fact, comparable levels of spending on healthcare. What do you think happened there?
Thank you. This is happening, as you see the example of states like Kerala. In Kerala, there is education. That is the most important thing, education of the people. And most people have exposure to foreign countries, so they know the hygiene, they know about education, and there is not very much disturbed male to female sex ratio and cleanliness. This is the highlight of Kerala. As the education level drops, we get the changing statistics. This is one. When we talk of Punjab, according to me, the Punjab people have enjoyed always a good health. There is always less pollution, there is always good amount of the food, purer food, stronger food, and financially also they are doing better than the states like Jharkhand and Bihar. So these two are the main factors. And third thing, the policies and the funding of the government which is reaching these states is distributed as per the culture of the state. I am using the word culture, and I would not blame anyone why I am saying culture. It's a work culture, you can say, or social culture, or you can say culture of obedience of the central government versus state government. These are the factors which indirectly or directly are affecting towards the betterment of these states, and this is how the results are plotted, which you have shown, which you have told just now. And we have to go beyond, we have to improve further, we have to improve on one universally on one point or one field or one area, and that is educate the people about child sex ratio, which needs to be improved in all the states, even including Kerala. So this is what is happening in India. We are marching ahead though, but very slowly. And one of the reasons is that we have lesser proportion of the GDP spent on the healthcare. Out of the pocket expenditure of the people is more than 70% or so. And the government schemes which are sent by the center are not totally implemented in the states. and that is the reason. You are talking about the Lakshadweep. Lakshadweep also is showing more learning about the central policies and showing more improvement in the plans which were imposed or which were given to the state for following. So this is another reason in states like Lakshadweep. In northeast states also, Manipur is ahead of learning process.
Absolutely, and that speaks volumes on how, in fact, the government also works towards this. But while the responsibility is shared between the centre and the states here, given that health is a state subject though, but implementation is largely done by states, and the centre's role is just limited primarily to financing, setting policy and principles and program guidelines. What do you think the state governments need to do to ensure better health care and implementation of such projects need to be speedy?
True, it is the responsibility of the state. Health invariably is defined as a state subject. But people who are sitting at the center, they send the funds also to the states. And it is up to the states to utilize the funds, have enough manpower, have enough paramedical staff. What is happening is a pyramid of people who are looking after the health matters in the states. The base of the pyramid is that our health workers need to be appointed where they are not there. There needs to be fresh recruitment so that the posts are not vacant. Then there are the health workers like ASHA. Then there are primary healthcare centers. Those primary healthcare centers should be upgraded. There are many primary healthcare centers in the remote areas where there is hardly any staff. They are being looked after by paramedical people. Doctors are not there. Either doctors don't want to go there or they are not appointed there. And at the peak, that is the district hospital, they are functioning nearly normally, but they have a lot of load. So repair has to be done from the base of pyramid, and actual repair needs to be done at that level, and all the funding and all the statistics collection and appointment of the staff at the base level has to be done, and this is the most important thing which is being observed. And in our present health policy, national health policy, which has come after more than a decade, the central government has emphasized to revamp the primary health care. Primary health care, I repeat, if the primary health care is not revamped properly, there will be a lot of burden on the secondary, tertiary health care, and this will be a chaos, which is happening. So this is most important.
Thank you, Dr. Wali, for joining us on the program and explaining to our viewers on how important is this health index report and what the country, and particularly the state governments and the government collectively need to do to address the healthcare needs.